Nick Jones, Vice President of Community Wellness at Nationwide Children's in Columbus. Welcome to the podcast, More Health, Less Healthcare. And as an intro, today's conversation, a few words are in order, I think, about just, really how important housing is. Affordable housing is really, to me, a central pillar of any population health strategy. It addresses a whole range of social and economic factors that are critical, to low-income families and marginal populations. And addresses, also the economic aspiration as well, like building intergenerational wealth, which is a mainstay of community stability. And, at the same time, it's this prospect of building a capital stack for hospitals to raise millions of dollars to put together this stack. This can be just overwhelming. And, that requires learning new skills, even going beyond the comfort levels of at least many hospital boards of directors that I've worked with. It means really collaborating with dozens, not just a few, but dozens of civic institutions to launch a comprehensive initiative. And it means committing to the long game, not short-term investments, but the long game of investing in social infrastructure of the community. This is exactly what Nationwide Children's has done, and it's an absolutely fascinating and detailed case study presented in the Health Equity Case Studies Handbook. Really, I think one of the most compelling case studies in the handbook with numerous what and how descriptions and a lot of appendices. So, Nick, walk us through really what was the intent beyond this, beyond the healthy neighborhoods and healthy families as a long-term strategy. It's really impressive. It's a long-term strategy, truly an intergenerational strategy. Walk us through it, how it came about.
Yeah, thanks, Peter, and thanks for having me on the podcast today. So yeah, Healthy Neighborhoods, Healthy Families really started a little more than 17 years ago because the hospital was in the midst of building a new inpatient tower
Right.
at the corner of where we sit and have sat for over 100 years at that time. But our board and our senior leadership said, if we're going to invest huge dollars in creating this inpatient experience, but still seeing our neighbors literally across the street from us facing poor health outcomes. We need to do more. Not just as a good neighbor, but as an institution committed to children's health outcomes. So that's why we started the Healthy Neighborhoods, Healthy Families initiative to invest really in the community immediately to the south of the hospital and really look at ways that we could support children's health with these upstream type of investments and interventions to realize best health outcomes.
Well, it's not just one or two programs. You have five different prongs. Walk us through what what are each of the prongs and why that particular prong?
Yeah. So we really take a housing first approach to this work. And so affordable housing is at the forefront of what we do. And we do that in three ways through creating home ownership opportunities, affordable rental opportunities, and then providing home repair grants to existing homeowners in the community. We also have an economic development prong, and that looks at everything from workforce development to individual financial coaching and folks setting financial goals for themselves and how we can support them to reaching those. To looking at some of the infrastructure in the communities that we have healthy neighborhoods, healthy families, and how we can support that work that is beneficial to a mixed income community. And of course, the third prong would be wellness. And so that's
Right.
just kind of who we are at the core. And that's providing access to kids and families where they are, whether it's through our primary care network and the locations that we have in our communities, or with our school-based health, behavioral health services that we offer in local schools. Education is the fourth prong, and that's everything from ensuring that our babies really are reaching their first birthday, but then becoming kindergarten ready and having quality early learning through post-secondary supports. And then the last is community enrichment, and that's really how we invest in community-driven work that the community thinks is important, like leadership academies, like festivals and social gatherings, but anything that can create that social cohesion, but also that the community is bringing to us as things that they think are important. So five prongs: housing, economic development, wellness, education, and community enrichment.
All right, the big question is the capital stack. How did you put it together? Because
Yeah.
it really funds each type of housing initiative, which is really impressive. How did how did it come together that you knew what the capital stock was going to have to be? What did you have to do to basically get your arms around that?
Yeah, so when we started our housing initiative, we really focused on two areas: home ownership and um, home repair. It wasn't until really about almost 10 years into the work that we added this affordable housing effort that required this type of capital stack, structure to do scattered site affordable rental development in the areas that Healthy Neighborhoods, Healthy Families focuses. And our partner, Community Development for All People, which is a faith-based community development corporation on the south side of Columbus, has been in partnership with us in the housing work from the start. And their founding executive director, Reverend John Edgar, was very influential in what mechanisms can be used to create affordable housing. The capital stack being at the forefront of that. We were also lucky enough to have a CFO who now is our
Yeah.
CEO, who understands all of the financials and is able to talk all of that finance language that folks like me maybe aren't as skilled at, and really work with a local housing syndicator to bring this capital stack together that has experience in bringing together financial institutions, private philanthropic investment, public money through partners like our city and county, to really make something like this work and to establish at that time a $20 million investment to create 150 affordable units. And that was just, we got the right partners at the table, folks that had experience in doing the work or had the know-how to do the work, and put it together.
So who are the right partners? Can you generalize, or is it just this is what we had to do in Columbus? Can you
Yeah.
generalize from that?
The right partner certainly, for us, that the partner that kind of helped make this capital stack functionally come together was that housing syndicator, the Ohio Housing Capital Finance Group. And they were able and have relationships with the financial institutions to provide the type of financing we need to make something like this financially feasible. Those financial institutions were investing low interest loans into this capital stack that allowed us to break even on the development that we put out there for affordable housing, and not have to take on any type of higher interest uh, financing, to roll this out. So without that partner, we certainly have difficulties in bringing a capital stack like this together. And then, I would be remiss if I didn't, say that an institution like Nationwide Children's is important to have because it's a respected institution, obviously missionally and just kind of what we do at the core, but also because of the type of financial, uh, um, I think, history and respect that we have in the funding community, whether it be from the financing side or from the equity side, for folks to have confidence that this type of financial mechanism will lead to a return for them, albeit maybe not a large return, but they certainly will not lose money on this investment, which I think is important to get some of these financial institutions to invest in the work.
Well, you mentioned the role of the CFO. I'd like to go back to that because really there was an enormous trust building process that had to take place. As an institution, how did you regain that trust? Because there's a whole history of mistrust. How did
Hmm.
you overcome that? What were the skills that it took? And it's probably an ongoing process, but when you think back a ways, what was the process that was necessary to re-earn the trust of the community? And why
Yeah.
was it so important?
Yeah, I think, first and foremost, I can't I think overstate the importance of a partner like Community Development for All People and its standing in the South Side community, and the relationship that it had to 30,000 Southsiders at that time. They had the respect, the buy-in from the community that maybe we didn't have at that time. And so our attachment to them, our relationship with them was very critical, but that could only take you so far for so long. We had to have those direct relationships with the community as well. And so we put a lot of time in establishing things like a good neighbor agreement, where we regularly provided updates to the community, brought them into the hospital to talk about future, plans and get feedback from the community on those, and then respond to any concerns or questions that the community might have with that development or with the work that we would be doing in the community. So if the community said, hey, you guys are building these new facilities for your own services here, we don't want you to build east into the residential community. So what did we do? We heard that and we built west, where there weren't homes, where we weren't, trying to, infiltrate some of that residential area. And so those direct relationships, actions that we took as a result of those conversations, I think have been critical to our long-term relationships. But to your point, it's always a work in progress, and we're always looking for ways to adapt and adjust to that, whether it's establishing our own advisory councils, whether it's having our senior leaders, at the table with community leaders, to know that, hey, anything that you're asking for from the hospital, there's a real decision maker sitting right across from you, that's hearing that feedback and that's responsive to that feedback. So that has all been, a part of this process. There's not one magic pill. It certainly takes um, different efforts, different approaches in the aggregate to make something work.
From what I gather, the role of the CFO was pretty important. He didn't just stay in the office and do spreadsheets. He was
That's
in the
right.
community. How important was that role as, maybe the face of the institution? What did he have to do to basically gain the trust and extract what it was that the community wanted, like building in a certain direction?
He's now our CEO, but our CFO at the time was as important and critical an individual in both establishing and sustaining our community-based work as anyone. And he certainly had the vision early on around what our investments might yield. What our investments at that time might yield 20 years later. And so I think a couple of things. One is he developed a great relationship with the leader of that community organization, Community Development for All People, and really built a really trusting relationship with someone that the community trusted. And so when that, Reverend was out talking to his parishioners or out talking to people on the street, he really brought validity to our CFO, and our institution at large, for the real honest intentions for us doing the work, and ensuring them that there were no sinister type of
Sure.
reasons for why we might invest. And I think too, you know, the community having someone like a CFO of a nationally recognized institution sitting at the table with them, hearing from them, and then showing them that he's listening by instituting these institutional, either directives or investments, really brought um, a level of authenticity to that engagement that the community ended up respecting and believing that it wasn't just someone sitting in the ivory tower that
Yeah.
would give a bunch of would say a bunch of words, but really wouldn't have any actions. And I think we always say at Nationwide Children's, we are a bunch of doers. We like to get our hands dirty, and certainly engage in, the right conversations, the necessary conversations, and play the role that we can play. We can't do everything, but we certainly are not going to shy away from a conversation for what's best for kids and families.
I hear you. Let's also talk about whole person care. I know you that's really important to you. And whole person care, it's a buzzword as often as not. It means different things to different people and organizations. Um, it really comes with, I think, a 24/7 focus on the family. I mean, at its essence, whole person care starts with investing in early childhood education. And that, again, comes with a 24/7 focus on the family. Focuses on the whole family, not just whoever kid or adult may be sick at the time. It means comprehensive wraparound services. There's a key phrase that kind of sums it up. The phrase is keeping kids healthy at home, at school, and in the neighborhoods. I think that's one of your phrases. How do you put that phrase into action?
So, excuse me. Sorry. I think, excuse me, it really was the intention of Healthy Neighbors, Healthy Families in those five prongs to be a wraparound effort that did support families in all five of those areas. I don't
Mhm.
think, if I'm being honest, that we really um, live that out until, about, um, you know, 8 to 10 years into the work. And so what that means is that, we are providing, and this is an old, terminology, but I think it's still relevant to this day. We are providing a no wrong door entry into anything that we might have to offer through our initiative and our partnerships. So that means that if we have someone that's coming in through our rental housing, they're getting connected to our job training program, or at least, folks are
Okay.
knowing that it's available. If someone's coming in through our kindergarten readiness program, we're saying, hey, did you know that we have housing available? Did you know that we have school-based health services at the school that your soon-to-be kindergarten will be going to next year? And so, the expectation is that once we have a touch with the family, a relationship with the family, we're focusing on the whole care and everything that we can provide. Are they connected to, a provider where they're getting that well child check every year? Are they making sure that they know that we have a free tax assistance program and they're bringing their taxes to us? And so it's looking at that holistically and ensuring that any type of barrier that they are navigating, that we have some type of protective factor that can address that, either directly through what we have to offer or through a partnership that we may be supporting.
Yeah, I was struck by one of the comments in the case study that the tax preparation assistance program, it has returned what, some millions of dollars to the
Yeah,
community? Is that right?
over $5 million
Wow.
in the last 5 years that we've been doing it.
I mean, it seems so obvious, right? In retrospect, that's community
It it
building.
it does, but I think, and with all this work, quite honestly, Peter, a lot of this stuff I wouldn't say is necessarily innovative in the fact that all of the things that we're doing have been discussed in academic journals and research and practice for decades. But I think, again, what makes our work successful is that there is a real ingrained uh, uh, just effort and belief that we have to do this type of work and investment if we are going to ensure that our kids are able to live out their hopes, dreams, and aspirations in the future and be healthy. And so you just have to have that will to be able to commit to the work. Start small, but certainly that will to be able to commit to the work and know that what you're trying to address wasn't created in a year or 5 years. And
Right.
so, the results necessarily aren't going to be seen in a year or 5 years, but over time they certainly add up and create healthier communities.
I mean, it really seems like applied common sense to me, but it's not very common.
Yeah.
Hey, let's look at your population health program overall. What makes it both effective and sustainable?
So I think there's several things. I think one, we have partnered with a variety of community-based organizations, public government, so city and county, private funders, financial institutions, school districts, everyone that one is having some type of touch with a kid in their family, but
Right.
two. Folks whose goals are aligned with ours, to create some type of one measurable but two sustainable investment in the work. We're not trying to create something that's duplicating what's out there or that's really just chasing the money. I think secondly, we are affiliated with an accountable care organization. We have the oldest accountable care organization, pediatric accountable care organization in the country, Partners for
Oh,
Kids. So we assume financial responsibility for almost 500,000 kids on Medicaid in the state of Ohio. That means that we want to ensure that all of our kids are getting the necessary care and that they're not, having to, eh, you know, live in, unhealthy or be exposed to unhealthy type of communities or situations. And so there's certainly a financial um, motivation to make sure that our patient families have access to the right care, but two are living in healthy communities. So that certainly has been, an underlying motivation for this type of population health work. And our Partners for Kids team does as good a job as any in ensuring that kids' care is coordinated in the right way and that they're accessing the care that they need.
just want to make sure I heard this correctly. As an organization, you go at risk, financially at risk for 500,000 kids.
That's right.
Wow. Uh, End of conversation. I wish I could say that about every major hospital in the country. All right. So in terms of impact, what are the outcome? You've been, doing this for a number of years. What's the impact in terms of outcomes?
Yeah. So we established something called Pediatric Vital Signs, which looks at 8 population health measures for the county at large. And part of that work is to use our Healthy Neighborhoods, Healthy Families geography as the petri dish for the measurements in those 8 areas for the county. And so we're looking at things like high school graduation, kindergarten readiness, child mortality, infant mortality, and we are seeing real measurable results in our H&HF geographies attached to those areas. We're seeing higher graduation rates. We're seeing growth in kindergarten readiness. We're certainly seeing, impact on the infant mortality rate, and that's an ongoing challenge, especially when you look at the disparity rate. But
Yeah.
certainly seeing some progress in those areas. So, from a long-term perspective, we're starting to see some good growth in those areas. We also, though, are not immune from doing some widget counting. So we just passed our 1,000th home impacted since we started this work almost 17 years ago. We are now have over 2,000 employees who live who live within our H&HF geography. So we are hiring from our communities and ensuring that folks are in livable wage career pathways. And that's not doctors and nurses I'm talking about. That's folks that are starting off as patient care assistants and moving into a nursing track. That's folks that might be working in our patient access side and going into more of our customer service pathway. Those are folks that
Sure.
are really building a career at the hospital from our community. And then things like the tax program that you just mentioned, returning $5 million directly to our community, not charging families to take part in that. So that's $5 million that's going directly into our community's members' pockets. Those are all, I think, outcomes that we've been proud of, and certainly that we celebrate at both, an immediate timeline, but also as we look into the long term of what type of impact we might be having.
So each year, is there I would call it a floor or a ceiling as to how big the investment in social infrastructure in Columbus is going to be? Does it vary by year? What's the guideline for this? What's your
uh,
appetite for risk, I guess is what I'm saying.
yeah, it's a great question. I don't we certainly don't set our limits in what type of investment, ultimate investment we could make, because, if funders, if partners come to us with, resources to be able to advance, the work in a real robust way, like we did when we expanded Healthy Neighborhoods, Healthy Families to a second neighborhood about 5 years
Right.
ago, um, we're gonna we're gonna do that. Obviously, we're gonna make sure that it's a sustainable type of investment for us, so we don't have to take the work away when that initial money runs out.
Sure.
And I think that's been really important for us, that we don't just chase the money. That if we do invest in something, we hire people, that it's a long-term commitment for us. Um, but we haven't necessarily set a ceiling for that. I think the floor for us really, Peter, is ensuring that we're always looking to validate the work on an annual basis, and that means that um, we always are going to have something going on, that we're going to have a tax preparation program going on every year. We're going to have, we're going to be building new houses every year. Now, some of that is dictated certainly by the economy, and that's now more than ever, right now. What cost us back in 2018 to do 150 homes has pretty much doubled since then. So, things are certainly more expensive, but we really look at ways to both validate the work, and then secondly extend the work with partners and resources that might be out there.
Sounds like a very honest statement.
Yeah.
Well, maybe the final question, and I guess more of a personal question. What gives you hope and optimism about working with all these families in Columbus ongoing?
I think Columbus is certainly going through a lot of great growth. We're getting a lot of private investment. We're seeing a lot of folks move in. All of the growth in Ohio pretty much is occurring right now in Columbus. I think we've added, over 225,000 new residents in Columbus alone. In the state at large, there's been an add of about 23,000. And so there's a real draw to Columbus. But that means that there's a lot of folks here who are at risk of realizing, the excitement of that growth and the opportunity from that growth. And that is certainly why I continue to be committed to the work, and really why I'm proud to be at an institution like Nationwide Children's, who again has committed to the work in our most recent strategic plan. We just approved that over the summer. And even with all going on, they said, you know what, we're going to triple down on this and continue to have this be at the forefront of what we do. So I'm certainly there. And I think personally, as I sit here talking to you, I see my 10-year-old son in the distance. And I want to make sure that I'm doing what I need to do to create as healthy a community and environment for him to do whatever he aspires to do in his life, and that he can be proud of his dad doing.
Good comment. Well, Nick, thank you so much for sharing all of what you've learned and the organization itself, and really for making just a very, very significant contribution to this book, the Health Equity Case Studies Handbook. I think your presentation in the book it's really inspiring. It can be, you are doing it.
It's
Not
great.
only is it theoretical, you are doing it, and your work has been really inspiring. So thank you.
Thank you, Peter. Thanks for highlighting our
Yeah.
work and really appreciate it.